Hey, what's going on, guys? Welcome to another video on my channel, Hairliciously. If you guys are new to the channel, please make sure to hit that subscribe button so you guys are updated on hair loss and hair transplant topics, as well as video topics covering current hair loss treatments in the pipelines. Visit my website at hairliciously.com to purchase your microneedling devices, which is scientifically proven to stimulate hair growth, my low-level laser therapy cap, DHT blocking shampoo and serum, hair growth vitamins, and a few other products for those who are suffering from hair loss. In today's video, I wanted to talk about hair transplant clinics in Turkey. As you may know, Turkey is one of the top destinations for people who are considering getting a hair transplant. Medical tourism in Turkey is huge, and as far as hair transplants are concerned, I think around 50% of all procedures are conducted in Turkey, with over 350 hair transplant clinics in Istanbul alone. So medical tourism is growing at a pretty rapid rate across global markets in Turkey every year, and people obviously go to Turkey for a reason. Most clinics offer very reasonable costs compared to other clinics, let's say like in the US or other parts in Europe, where pricing can be upwards to $15,000, $20,000 USD, and even higher in some cases. And the quality of service in Turkey is top notch, obviously depending on which clinic and doctor you go to. And oftentimes, many of these services provided from Turkish clinics cover things like the logistics and accommodations and hotels and food. So it is a very enticing offer, all for a fraction of the cost. Now, with that said, there's always been a stigma when it comes to getting a hair transplant done in Turkey. And I kind of wanted to clear up some of the misconceptions that some people may have and also give you guys my insight regarding this topic. From what I've seen over the years, I think this ideology stems mainly from the fact that these Turkish hair transplant clinics and doctors utilize technicians to do a good portion of the procedure, whether it's the extractions, the incisions, or the implantation process. There are clinics that do utilize technicians who are going to do the majority of the hair transplant with little involvement of the actual doctor. Typically, these are the cheaper priced hair transplants that sometimes come in bundle packages, and they don't charge you by the graft, but by the size of the hair transplant. So, for example, a clinic can charge you about 1,500 euros for grafts that are up to 2,000, or 2,500 euros for grafts up to 4,000, and so on and so forth. Now, there are people who are going to criticize this because they expect that the doctor needs to be involved as much as possible in the procedure. They expect the doctor to do all of the extractions, all of the slits, and all, if not most of the implantation. The funny thing is that there are just as many reputable hair transplant clinics in the US and in Canada, throughout Europe, that also utilize technicians in some of the important stages of the surgery, such as during incisions or extractions. And I honestly don't see too many people complaining about these other, non-Turkish clinics. So it really doesn't make sense to me when so many are just focused on targeting Turkish hair transplants. This can stem from the fact that Turkish clinics are heavily marketed all over the world compared to, other clinics. And being that they are the #1 destination for hair transplants, I think it's also the very reason why a lot of people are fixated on Turkey. I don't think personally that it's fair for people to perceive the stigma on Turkish hair transplant technicians, because not all technicians, believe it or not, are going to give you horrendous results despite the lack of intervention of the doctor during certain portions of the surgery. I think it's easy for us to see the negative side of improperly trained technicians who have ended up with botched up hair transplants, over-harvested donor areas, and implanted grafts in the wrong angles and directions. And as a result, that has carried over to nearly all the technicians in Turkey that are involved in hair transplantation. When in reality, there are just as many highly trained and experienced technicians who are going to give you good results. Now, with that said, there are also hair transplant doctors all over the world, not just Turkey, that are not going to end up giving you natural looking results. They can just as likely botch up and deplete your donor zone, through over-harvesting, and just give you a very unnatural looking hair transplant. And this is all despite getting the majority of the procedure done by a medically licensed doctor. I've seen so many results where the doctor does all of the extractions and where they're highly involved in the majority of the procedure, and yet they still end up giving patients with unsatisfactory results. So ultimately, I think what it comes down to is that there are certain things that you obviously need to be aware of before getting hair transplant, whether that's in Turkey or some other country. The truth is that all clinics are going to utilize technicians some way or another. Some clinics are going to use the technicians more than other clinics. Certain clinics will have technicians that are going to do the majority of the procedure, while others may only utilize them during certain stages of the surgery, like during the implantation process only. It all depends, and I think it is the clinic's responsibility to be transparent and also to let patients know exactly who is taking control during the procedure. It's also crucial that patients ask this question during the consultation stage to really understand if the doctor or the technicians are doing the extractions, the implantations, or the incisions. I know that some of you guys are going to be adamant that the doctor do the majority of the work. And there's nothing wrong with that. We all have our own preferences when it comes to getting a hair transplant. And if that's what you want out of your hair transplant, more power to you. If you're okay with the technicians being involved, it's also important to know that you find out what type of training that they received, how many years of experience that they have at the clinic. This is important because there are clinics that will try to maximize profit by using technicians who don't have much experience, because obviously, they're going to be cheaper to use. And if they don't have experience and if they don't have proper training in hair transplantation, this is what can lead things to like overharvesting and, a pretty bad outcome. I will also include the fact that experience always does not translate to good results. And even if a clinic were being honest about the experience of their technicians and their qualifications, honestly, there's really no way to verify that. So it ultimately comes down to a matter of trust and believing that the doctor and the technicians ultimately have the right skill set to perform a successful hair transplant. As far as my thoughts, if the technicians have indeed been trained, properly trained to do the extractions, and they also have a consistent track record of excellent graft survival, I would be totally okay with this as far as this being an option. As far as incisions though, I personally would want the doctor to be involved over a technician, since we're paying for the doctor's artistry in creating natural hairlines and the illusion of good density. And at least for me, this is extremely crucial during the incision process. That's not to say that well-trained technicians aren't able to do a good job as well. But in my case, personally speaking, I honestly would want the doctor to be involved, particularly at least the incision process, which I feel is a bit more specialized and require the meticulous work of the doctor that has been perfected through years and years of hands-on surgery, versus other aspects of the procedure like the extractions and implantation processes, which are just as equally important, that can be properly conducted by the techs with adequate training. Now, when it comes to extractions, regardless of whether a technician or a doctor is performing it, you want to make sure that they are using the correct punch sizes, as well as a strategic and well-calculated extraction method to avoid over-harvesting the donor zone. You always want to minimize transection rates as much as possible during this process, because this is what is mainly going to determine whether the grafts that were extracted and implanted are going to be growing hair or not. During the incision process, you want to make sure that they are created at the proper depth and the proper angle and adequate spacing in proximity to give you good density. And finally, you want to make sure that the proper graft sizes are utilized in different regions of the scalp. If you're focusing on the hairline solely, you want to gradually transition and build up in density and utilize single grafts while reinforcing it with multi-grafts in the back. The only clinics that I would recommend are the ones who are ethical for obvious reasons, clinics that have proven results through, unfiltered before and after photos, results that are consistent with each and every one of the patients, and, ultimately clinics that are honest and transparent with their techniques and also their use of technicians who have to be highly trained with years and years of supervision by the doctor and experience in the field. Every procedure needs to be well planned, with a consultation by the doctor. And, not some clinic that just draws, a hairline by the doctor and just kind of throws in the operating room. The donor zone also has to be carefully assessed before and after surgery, and a strategic plan has to be outlined. And even after the procedure, I think aftercare is very important. Regardless of how much the doctor was involved in the process, the implanted grafts and the final results need to be reassessed by the doctor. And I think this is exactly how a clinic that is operated by both the doctor and technicians should, in my opinion, should run. I feel like a doctor and his or her clinic that has an ethical reputation wouldn't risk hiring half-assed technicians who do poor work and ultimately jeopardize, their reputation. So all in all, what it comes down to is you want to do your due diligence in research. Find a clinic that has a reputable doctor, that has a good track record of high quality and phenomenal results. Make sure that the technicians are well trained and experienced in the field. Find out exactly what role the technicians and doctor have during the procedure. And I think by doing so, you guys are going to ultimately save a lot of money and headache in the long run. So hopefully this video has been educational. If you guys have any questions, make sure to leave me some comments in the comment section below. Thanks again, and I will talk to you guys in my next video. Take care.